Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then the next type of incision we have is the diaphragmatic incisions. We have three types of diaphragmatic incisions, that is circumferential incision, central tendon incision and radial incision. Now we will see what is central tendon incision. Okay, the central tendon incision has already said in the diaphragm we have a central tendon which is derived from the septum transversum. So if you put an incision along the central tendon, then that is central tendon incision. This central tendon incision, number one, it does not interrupt any nerve. Okay, it does not interrupt any branch of the nerve, any major branch of the nerve, and it definitely provides better visualization from the abdomen from the thorax. You can easily visualize the abdomen from the thorax with this incision, or we can also visualize thorax from the abdomen also. Either ways it is better, better better method for visualization of abdomen from thorax or thorax from abdomen. And this central tendon incision is an easy incision to open, and it is easier to close. It is easy to open and easier to close, right? So this is central tendon incision.
thank you and thank you for watching.